Hi everyone, my name is Godfrey, and COVID did not feel super real until it happened to me. I'm fully vaccinated, a sports enthusiast, 23 years young, but I still hit the jackpot. Ever since I was the first to be tested positive within my known circle of friends, a few friends have approached me for advice, as their family members have tested positive, and the information from MOH is really unclear. Along with the rising number of cases, I believe sharing my experience will be helpful for others, whether serving isolation yourself or trying to help a friend or family member. Let's take it back to 19th September evening, and I did my ART as part of work requirements at an F&B. It was the first time I saw a double line and was asked to take it again. Maybe the ART kit was faulty or false positive. The second time showed the same thing, as was the third. My managers wanted to triple confirm. Then I immediately left the restaurant to an isolated open area as I waited for further instructions from my managers. After all, it was the first time they had to deal with a positive case. I'm not sure how things are at my workplace now, but looking back, it must be strictly enforced across all organizations that ART is conducted before the shift starts. This will ensure that organizations do not run the risk of having employees who might have COVID come into contact with other employees or guests. Half an hour later, at 9:15, I was told to head for a shag clinic via private transport. Though it was close to my workplace, I needed to be socially responsible by not taking public transport as I'm potentially carrying the virus. I tried booking for Grab, and having put SHN under the remarks, I was cancelled twice, which was really mean of them. But I can definitely understand why some drivers would do that, as their livelihoods would be on the line. In the end, the Comfort Delgro app helped me get to the clinic by 10:05 p.m, where I received a PCR test and an official form to head straight home for self-isolation while waiting for the swab test results. So I stayed inside the study room, which you all will see later. Then, 20th September, 8:41 a.m, I received an SMS from MOH that I was tested positive. Right after, I made various phone calls and texts to my managers and colleagues, telling them that I will be MIA for a while, feeling fine, except for the loss of sense of smell and taste, and also for contact tracing at work. The message included, a healthcare professional and MOH will contact you soon. The shag clinic called me at 10:18 a.m. to ask if my place was suitable for home recovery, which I said, preferably not, since all of my family members were frontliners or service staff. MOH reached out to me with two SMSs, one regarding home recovery suitability at 4:14 p.m, another regarding QO registration of household members at 9:22 p.m. That day, there were 917 cases reported. Closed community facilities and hospitals were extremely tight in resources. That was when I realized I should just do home recovery and leave those really in need of greater care.
Right, so it's day 2 of my 10-day home recovery. Thought it'd be good to just show you around a simple room tour. Important to always have your mask on so you don't spread to your family members even though you're doing self-isolation. My pack of essentials with about 4 to 5 days worth of clothes, even though I don't really perspire in this setting. Hand sanitizer, tissue, kitchen towel, constant wipe down, important. This is my bed during quarantine. It is also a driving rig. It is more comfortable than it looks actually. And of course, this is my man cave. I had this set up in end August for work and play study purposes. Totally didn't expect this would end up being an important thing for quarantine. A lot of entertainment on here. YouTube, Disney Plus, ICE, PS4. Important to type through my assignments. Important to also not on your aircon. Open the windows for ventilation. And a toilet. I understand not everyone have a toilet for isolation. I'm really thankful for this. My parents' room is currently locked. And importantly, good to have an area to put the food or other essentials family members can put there. Yeah, that's about it.
22nd September, early morning, my family members finally received the QO SMS and were given a link to book for a PCR test, only available at a regional swab center. Later that afternoon, they completed their swab test and collected ART kits that were sufficient till their QO ended. In hindsight, I'm really glad I completed my Saitama challenge before this. And from 10k runs to less than 1k steps a day, I really have to reduce my calorie intake. And if not for ART at work, I wouldn't have known. So if you're not sure, please go and get tested. On this day, I also began communicating with a church friend whose father had contracted COVID a few days before me to see if the information we had gotten was similar. Sounds weird, but quite thankful for y'all. Otherwise, I'd be a headless chicken running around seeking answers this whole time. As if quarantine cannot get worse enough. Hi. It was also my dad's birthday, and we had to video call even though we were only a door apart. 23rd September, afternoon. My family members checked the Health Hub portal and fortunately had tested negative. Thankful for the various gifts received from my close friends and financial agent respectively on that day. After calling MOH and Certis Cisco for so many days, I finally managed to have a clear, meaningful call on 24th September, 4:49 PM, which can be summarized here. So the first point went like, there is no exit swab or official documents necessary. You may self-discharge after 10 days of home recovery. Feeling puzzled, I pointed out to the call operator that this self-discharge thing presented an extremely big loophole. I shared this right away on my Instagram stories. That means it's the responsibility of patients to be civic-minded, which at this point, I really don't have faith in our citizens. People can do really silly things and just self-declare if they want. I will personally take a precaution and should be staying home a slight while longer. Like, seriously, even if a patient was unwell, yet if he or she insisted on resuming normal life activities, no one would really know. Especially if he or she solely patronized places that did not require trace together, like coffee shops. 27th September afternoon, someone from MOH called to tell me that they would be calling me later at night to arrange for an exit swab test. At that point, I was lost, cause just a few days, didn't y'all give the latest directive to self-discharge? Or am I stuck with the old procedure for whatever reason? If the lack of uniformity and clarity remains, all of us are in trouble. Anyway, the phone call never came back, and it turned out to be the last phone call with MOH. Regardless, it was a damn joke when you realized even if the exit swab test was really required, they could have just arranged it during that same phone call. Today's date is 29th September, and it's day 10 of my isolation. So, by right, there is supposed to be a PCR exit swab, but with the manpower crunch currently, who knows? And also the latest directive says that patients are supposed to self-discharge if they are feeling well after day 10, and if they are feeling unwell, then they can request for the PCR. But it's a lot on the self-responsibility, social responsibility of patients, which Singaporeans right now no faith. But I'm gonna do the ART and see if I still any COVID traces. September, 2:24 AM, I finally received my isolation order as a COVID positive case. Receipt, issued to you on 19th September, has lapsed on 28th September. Come on man, this should actually write lapsed on 30th September. I needed this isolation order SMS from the beginning to officially justify my absence from various commitments. Not all workplaces are built on trust or buy into pictures of your ART or PCR results. And the funny thing was, I kept thinking my day 1 should be the day I received the SMS that I'm positive, which rightfully should start from the day you took your PCR test, as per Health Hub. But it's all good since I did more days of isolation rather than less. I didn't intend to go out so soon, so it didn't matter much. From being tested positive to finishing isolation, I did not have any flu symptoms. I lost my sense of smell and taste, which was regained on 2nd October. During isolation, I figured perhaps it could be triggered back by a strong flavor, so my brother cooked something spicy. I perspired and teared up because of the spiciness, but I couldn't taste the food. So even though I craved bubble tea, there was no use ordering it in when I couldn't taste anything. And the amount of hand sanitizer I used in the last 3 weeks is more than what I used for the whole of last year. Right now, I'll be highlighting some issues that surfaced during this whole isolation or cure process. First point, let's acknowledge that there is an extremely serious manpower crunch, a clear disproportionate number of staff compared to the sudden surge in cases since early September, and that is still climbing. Yes, this is happening everywhere around the world, having dealt with the pandemic for more than 20 months now. When you consider the overall fatigue, mental distress, limited contact time with loved ones, the high risk of getting COVID themselves, frontline workers, healthcare workers especially, need to be remunerated better, not just paid lip service. Artistic dedications are great, but not practical for those having to put food on the table. Second point, based on my own and many others' experiences, the current systems are extremely flawed. Maybe it was due to the clearing of the backlog of cases, I'm not sure. But how can an isolation order be left for so many days? Like I received mine on 30th September, not 19th September as written in the message. Whether it is isolation or cure notice, this lapse is unacceptable. The templates are readily available to you. What needs to be vetted before sending out will be 4 details: name, mass IC number, start date, and end date from the Health Hub or QO form responses. If people do not receive their notices on time, trust me, people will test the system and devise ways like angularly longer. One thing is to find them. But by the time you find them, they would have roamed around and risk infecting many others already. If this was clearly thought of, it doesn't matter whether you are dealing with 100, 1,000 or 3,000 cases. The protocol is straightforward. Third point, before I state the criticism, there is something to praise about my family members' PCR exit swabs for their QO. The PCR test was scheduled at our home, so my family members didn't need to make a separate trip to the clinic, which would have wasted time and money. The staff was really proficient at administering the PCR, that he or she only took 5 minutes to complete taking 3 results. However, here comes the criticism. Despite being taken at the same time, my mom received her test results more than a day later than my dad and bro. Not to forget, I recently heard a story of a false positive PCR test from a friend. More than half of those samples in that batch were found to be false positive. Fourth point, this is for MOH and Certis Cisco. Why have a hotline when it's mostly ineffective? Try calling, then be told to hold on. To the point it says, give us your number, we'll contact you when we can. But you all never actually called back. That one time I successfully connected through, out of nearly 30 tries, the call operator told me, you can check the MOH website's FAQs to find out. Come on sis, whatever written there is idealistic, but inconclusive and unclear for all situations. And then expecting illiterate people or auditory learners to digest that information? No way. Fifth point, my Trace Together app's test not cleared red symbol did not turn green on day 10 of my isolation. It was supposedly day 10 for the fully vaccinated, day 14 for the unvaccinated. So mine had only turned green 10 days after my isolation had been completed on 8th October. I'm pretty sure according to the news there was a glitch, but this is no excuse. Think about those who have to return to work and be physically present at the workplace. They are barred from entering if Trace Together showed test not cleared. For me, as a student doing part-time jobs, I could hold off work for a short while. I was planning to anyway, so my issue of not being able to dine in at restaurants pales in comparison. But still, this should not be happening. Then, some people will say, "Aiya, just get exit swab lah." But precisely we were told to do self-discharge, so we did not do it. Of course, we could head for clinics to do the swab at our own expense to turn the symbol green earlier. And that is not fair. It's not like we purposely contracted COVID and did not want the exit swab. So the Prime Minister made an address on 9th October noon, hoping that more people would be compliant, chillaxed, and understanding why we weren't opening up as fast as we thought we could. However, as a regular Singaporean, I felt that if his address was to reiterate things we already knew, such as living with COVID, expecting the number of cases to continue to rise, longer runway to normalcy, greater divide between unvaccinated and vaccinated people, so more are encouraged to get vaccinated, etc., then why couldn't he speak up earlier? I know this sounds like maho pao, but a more opportune time would have been when we were at 1,000 cases per day, and when instructions given by the authorities were so messy. Rather than let things snowball to this extent, then decide the next move. Nevertheless, there were two good things that came out after the address. The first good thing was replacing QO with a new simplified protocol. This would somewhat address my earlier third and fourth issue. Moving forward, people are expected to be more socially responsible with self-testing, monitoring your own situation, seeking the doctor only if you're unwell, heading to A&E only if you're super jialat. Hence, the amount of PCR testing will be reduced and bring a lower chance of screw-ups. This includes false positives. Most people would fall under either of these three situations, and with this 1-2-3 protocol approach, it is very clear what to do. But the authorities should ramp up on covering the safety net for those who cannot undergo the home recovery program. For example, anyone with critical illnesses, the elderly, tenants living in the same household as their landlords with young children, those staying in one-room flats. Not to forget, there are people out there who might not have any friends to help them with running errands when they are self-isolating. I know there are NGOs constantly looking out for and have been helping out this group of people, but the government and media seem to have neglected them in their recommended guidelines and videos. The second good thing is the announcement of more countries added to the vaccinated travel lane scheme. Though this still alienates families with children under 12 from school holidays, it is good news that we are gradually opening up, and to countries that have good vaccination rates and sound measures. I know a lot of our Malaysian friends living here haven't been home for a while, but the instability in Malaysia really is making it hard for Malaysia to be included in the VTL. With how good our nation's governance and healthcare system is, I see a strong resemblance between Singapore and the 2016 Golden State Warriors that went for a historically best 73-9 in the NBA regular season but couldn't win the finals. Last year, the dormitory cases were well managed despite a crazy surge at one point of time, such that we could enter phase 3 of 8-pack gatherings at the end of the year. All of us thought we were out of the woods already and complacency set in. Testing was not done rigorously in many organizations, engaging in activities in mask-off posture and intermingling unless a safe distancing ambassador came by. Food places disguised as KTVs, and many other breaches that can be found in the news. I also miss karaoke, but there's always a right time for everything. "请让我用中文说几句。#抗疫不抗疫。没错，一开始的时候接种疫苗是个人的选择，其实现在还是，只不过政府新的措施让接种疫苗看似是强制性的，可能没打疫苗也能毫发无损。但是以现在的局势还有大数据来看，显然的是打疫苗来对抗冠状病毒是有所帮助的，虽然还是会中，但普遍上是比较轻微的症状。我想问未接种疫苗的人一句：当您在保护个人权益的同时，您是否想到这会间接影响到社会恢复新常态的权益吗？免除那些真正身体不适合打疫苗的人以外，我相信很多人因为看到一些施打疫苗产生副作用的报道而恐慌。我觉得无所谓， 要坚持不打就坚持到底，反正是个人权益，但就是不该乱散播谣言，尤其是那些滥用宗教名义的人。Among the COVID cases I know of, including myself, we are very fit, so complacency is there when we go out to exercise. Sometimes we mask off till we reach home, so there is that chance for the virus to be transmitted. And if we don't already know, COVID does not discriminate. I really urge all to mask on, wash your hands regularly, get vaccinated if you haven't. The road ahead can be long or longer, depending on our social responsibility as a country. If you are still here, thanks for watching.